Lactobacillus rhamnosus for stomach bugs, helpful or overrated? When people talk about probiotics for stomach bugs, Lactobacillus rhamnosus is one of the first names that comes up. For years, it was studied in children with acute diarrhea and gastroenteritis, and several earlier analyses suggested that it could shorten the duration of diarrhea and possibly reduce hospital stay in some settings. So that sounds like a clear win, right? Not exactly. A major randomized trial published later in children with acute gastroenteritis found that Lactobacillus rhamnosus did not improve outcomes compared with placebo. That result got a lot of attention because it challenged the older probiotic narrative and reminded everyone that not all promising meta-analyses stay strong when large, rigorous trials arrive. This is actually a great lesson in how science works. Earlier studies may include smaller trials, different patient groups, different viruses or causes of diarrhea, different healthcare systems, and different timing of treatment. Then a larger, better-controlled study may show a smaller effect or no effect at all. That does not mean the earlier research was fake. It means the true effect may be narrower, weaker, or more context-dependent than people first thought. So how should you explain this simply in a video? Say this: Lactobacillus rhamnosus has historically been one of the most studied probiotics for acute infectious diarrhea, and some earlier research suggested shorter illness duration, but newer high-quality trials showed no clear benefit in some children with gastroenteritis. That means the evidence is mixed, not universally positive. This is also why blanket probiotic advice can be misleading. A person with traveler's diarrhea, a child with viral gastroenteritis, and someone with diarrhea after antibiotics are not dealing with the same biological situation. A probiotic that seems helpful in one may not perform the same in another. The smart microbiome message is not probiotics never work, and not this probiotic cures every stomach bug. The smart message is that Lactobacillus rhamnosus remains scientifically important, but the benefit depends on the exact clinical context. So if someone asks, should I take Lactobacillus rhamnosus for a stomach virus? The honest answer is maybe, but the evidence is mixed, and expectations should stay realistic. Earlier meta-analyses found Lactobacillus rhamnosus could reduce acute diarrhea duration, but the 2018 NEJM pediatric trial found no benefit versus placebo in acute gastroenteritis. Click on the description to watch the full video. Subscribe to this channel, because we turn complex scientific topics into simple and powerful information that you can actually use. And if you found this helpful, share it with someone who cares about their health.